Alright, I'm going to keep this one very brief once again. Today's topic is going to be just cardiology Q&A. For anyone who is here, just shoot me a message. Let me know if you can hear me before I start, but I will be starting in about 30 seconds. Once again, just shoot me a message before I can start. I want to make sure that everybody hears me okay and appropriately. But my name is Dr. Isang, and I'm a cardiologist using this platform to discuss things regarding their heart, health, and prevention. Why prevention? Prevention is a lot better than treatment. It's a lot cheaper than treatment. If you know what the risk factors for heart disease are, you can potentially prevent a heart attack, stroke, heart failure, kidney failure, needing to be on dialysis. So stress the importance that if you know this, you can do a huge impact on your life and people around you. Once again, if you guys can hear me okay, just type yes so I can know that people can hear me well, because I've been having issues with the volume. So I'm trying to make sure that people can hear me appropriately. I guess let me just start a poll. The poll is just, can you hear me? And it's just a simple poll. Please just answer, can you hear me, so I can start. Not sure if people can hear me or not. I will just talk into this a little bit better. So for people who haven't been here, my name is Dr. Isang, and I'm a cardiologist. I'm using this platform to talk about heart health and prevention. So when it comes to heart health, when it comes to things like heart attacks and strokes and heart failure, what can we do to prevent it? A lot of times it's knowing what the risk factors are. Things like hypertension itself, high cholesterol, hyperlipidemia, diabetes, a strong family history. All of these things make a huge impact in your life and in the future. So what does that mean exactly? So if you get the diagnosis of high blood pressure, you will likely not have any symptoms for a long time. That's one of the reasons why hypertension is known as the silent killer, because it doesn't show its face until later for a lot of individuals, unless you're actively looking for it. So you can go decades. I've had a lot of patients who question why this happened to them. They were living a good life for 30, 40 years, and then at age 50 they have a massive heart attack. Usually at that time they're put on medications to help with the heart function, but they also have been diagnosed with high blood pressure. In reality, they've probably had high blood pressure for a long time. They've probably had high blood pressure for multiple decades and wasn't treated. And that is a risk factor for a heart attack. So they probably also had high cholesterol, diabetes. All these things were not being treated and tested appropriately. Unfortunately, when it comes to chest pain, when it comes to the symptoms, when people start having chest pain, when it comes to heart disease, I apologize. When people start having, chest pain, that's usually the end marker of it. So they've probably had everything happen already, and now we're trying to prevent another heart attack. Now we're trying to prevent complications of a heart attack. So the importance of just knowing this is that if you have this, you can potentially prevent something bad from happening in the future. So talk to your friends, talk to your family, talk to someone close to you to make sure that they're seeing their primary care provider at least once a year. So when it comes to chest pain, what is chest pain that gets me as a cardiologist concerned? It's chest pain here. This is the mid-sternal region. Chest pain that radiates to the left shoulder. Chest pain that gets worse with exertion, running around. Chest pain that gets worse with exercise. Chest pain that gets worse with stress. Chest pain that gets better with rest or a medication called nitroglycerin. If you have all three of these, I am highly concerned that you may be having a cardiac event, or you have enough risk that we should further investigate this with a heart catheterization, where we go up the artery in the wrist or in the artery in the groin to take a better look. Now we understand now better that unfortunately, women diabetics, sometimes people with kidney disease may present a little bit differently. They may have atypical presentations. Instead of having the classic chest pains, they can have shortness of breath, they can have shoulder pain, they can have back pain. So we want to do our due diligence, and if we're getting a heightened sense of concern, also check blood tests to make sure that the blood enzymes are not elevated. If they are elevated, then still work them up for a potential heart attack. Other than doing a heart catheterization, what else can we do? We can do stress tests. We can do an echocardiogram. We can do a cardiac CT. So there's many modalities that we can use. We can utilize to investigate someone's chest pain. And if everything comes back normal, then we have to start looking at possible other causes, other non-cardiac causes of chest pain. We have things like inflammation of the sternum or costochondritis. We have the pancreatitis, the gallbladder, cholecystitis, GERD or reflux. All of these things can mimic chest pain and cause a lot of concern. And the one that I always want to use last is because I feel like there's people get called this way too early without doing a full evaluation. Sometimes it can be due to their nerves, or it can be due to anxiety. But I typically want to, diagnose that last, making sure that I have diagnosed everything or not diagnosed. I have treated them and evaluated them for all of the potential cardiac causes of this, and then had them follow up with their primary care provider to see if there's other tests that should be done. Now, and I see there's a few people on here. If you guys have any questions, please post them so I can try to answer some questions. All right, and then so my last one is just going to be on one of the biggest risk factors for heart disease. When I first spoke, was high blood pressure or hypertension. So when the top number is 120 or above, or the bottom number is 80 or above, if it's 80 to 89, that's known as pre-hypertension or at risk for hypertension. Just like if it's 120 to 129, it is pre-hypertension. Stage 1 is 130 or above, and stage 2 is 140 or above. You want to try to treat the potential things that can be causing your blood pressure to be elevated. This includes obesity, excess stress, excess red meat consumption, and things like that. Treat that appropriately. If losing weight can be a huge marker in potentially treating the blood pressure without putting people on medications, exercising regularly, and trying to get enough rest and reduce the amount of stress in your life as possible. I do find that if people have done this and are still have resistant blood pressures, they may need to be on medical therapies for this, and there's a host of a lot of different ones: beta blockers, calcium channel blockers, thiazides, hydralazine, a host of them. It's more about picking the right medication for that individual. So if someone is having leg swelling, you may want to choose the one that doesn't have that side effect of leg swelling. If someone has issues with their potassium, you may want to hold off on choosing one that can cause elevated potassium levels. But there's a stepwise approach, utilizing exercise and lifestyle changes, and then if that is not enough, then you can potentially add medical therapies to it. My name is Dr. Isang, and I'm a cardiologist utilizing this platform to discuss things regarding the heart, health, and prevention.